A Tale of Two Clinics. In a small town named Harbridge, nestled between two winding rivers, two health clinics stood on opposite sides of the main street. One was the sleek, glass-walled Vital Care, a private clinic with glossy pamphlets, touchscreen kiosks, and espresso machines in the waiting room. The other, more modest, was the town's public health center, Harbridge Health, housed in a brick building with peeling paint, an aging receptionist named Edna, and a faint smell of antiseptic and hope. When 12-year-old Maya fell off her bicycle and fractured her arm, her mother, Rosa, had a choice. Vital Care promised immediate appointments for a fee. Harbridge Health had a queue, but treatment was free under the national healthcare system. Rosa worked 2 jobs and barely made rent. She called Vital Care. "How much for an x-ray and a cast?" she asked. $2.90, the receptionist replied brightly. "That includes a complimentary orthopedic consultation." Rosa hung up, heart sinking, and carried Maya to Harbridge Health. They waited 3 hours, but Maya was treated by Dr. Gupta, a kind and thorough doctor who explained everything with patience. The cost, nothing. Dr. Jeremy Case, the director of Vital Care, reviewed the week's revenue reports. "Numbers are up," he told his investors. "We're focusing on premium services now. That means less time per patient, but higher throughput. Profit margins matter." Meanwhile, at Harbridge Health, Dr. Gupta stayed an extra hour past his shift to see an elderly man with a heart murmur. He didn't do it for money. His salary was fixed. He did it because he believed in the NHS, in care without condition. Then came the outbreak. A new virus swept through Harbridge like wildfire. Fear rose, people rushed to get tested. Vital Care introduced a $99 fast-track virus check. They advertised aggressively, but many couldn't afford it. Harbridge Health, with limited resources, did what it could. Nurses ran mobile clinics, volunteers handed out masks. They struggled, but they showed up day after day. When Paul Krugman visited Harbridge as part of a study on rural healthcare, he saw the lines outside the public clinic and the empty Vital Care lobby. He saw Rosa helping the elderly fill out health forms and Dr. Gupta giving a talk at the town hall. "You can't shop for healthcare the way you shop for shoes," Krugman said in an interview later. "The market breaks down when people have no time, no options, and no bargaining power." Months later, the epidemic faded. A town hall was held to reflect. Some argued the private clinic had its place. It relieved pressure from the public system, offered speed and choice. Others pointed out that, in crisis, it was Harbridge Health that stood firm. Friedman's vision of consumer-driven care with prices and competition seemed appealing, until real people with real illness entered the picture. Kahneman's warnings about human irrationality became tangible. People delayed care, made poor decisions under stress, and misunderstood risk. Rosa, now on the community board, stood up to speak. "I'm not against private clinics," she said. "But healthcare isn't just another service. When my daughter was in pain, I didn't need a menu of prices. I needed care, not when I could afford it. But when she needed it." The town voted to increase funding for Harbridge Health. They painted the building, Dr. Gupta got an assistant. And Maya? She healed well and decided she wanted to be a doctor too. In the end, Harbridge kept both clinics. But the lesson was clear. Markets may be efficient, but health is a human right, not a luxury. And sometimes, fairness, not profit, is the highest form of efficiency.